Now, a surge in the number of pets adopted during the pandemic has led to a major increase in business at veterinary hospitals. Stands to reason here. But it can also cause longer wait times when your pet needs help. Joining us right now is Leah Basinais, Director of Operations for Access Specialty Animal Hospitals. Thank you so much for joining us.
Thanks for having me.
What's the biggest issue you see at the hospitals right now?
You know, it's definitely wait time associated with the staffing shortages that we're facing. We've got millions of more pet owners, which is wonderful in and of itself, except that with that didn't come a million more veterinarians or the paraprofessional support staff. So we're dealing with staffing crises and long wait times as a result.
So as a pet owner, what can I do to keep from seeing you, having to go to the hospital?
Avoid me at all costs, certainly. There's three things that pet owners can do that I think would make a world of difference. And the first thing is really to keep your pet out of trouble. Now, I know it's hard. I've got a 10-month-old puppy myself, a COVID puppy, right? But don't give them table scraps and eat the human foods that we eat because they can't tolerate it the way that we can. Keep them on a leash. Don't take them hiking if it's 90 degrees outside. Get them those wellness checks that they really need so that they don't contract something preventable. The second thing is pet insurance. Pet visits to the ER are crazy expensive, so you want to be able to afford it if you need it, and it's a lifesaver to many people. But finally, be patient and be kind. There is such a shortage of staff members right now that we're facing, and if you have an 8 to 12 hour wait time, and you might, it's because your pet isn't the sickest one there, and you don't want to be the sickest one with the sickest patient. So certainly be patient to those that are waiting.
What do you do in an emergency? I have friends who've said, they've had an emergency, they call ahead, and they can't get in for a couple of weeks. What do you do then?
I think emergencies really vary in terms of their critical nature. To me, my dog scratches her ear all night and keeps me up all night, and that's an emergency. But when we're dealing with really life-threatening issues, emergency cases, toxicity cases, hit by car patients, those are the true emergencies that are making people wait. So what we're asking for is really to pet owners to avoid us at all costs whenever they can. Call ahead. Veterinary hospitals are closed to non-critical emergencies at times, so call ahead whenever you can.
You mentioned pet insurance, and I want to cover this very quickly before we go. We know the cost of hospitalization, whether you're a human or an animal, is very expensive. Is it worth it to get pet insurance?
I personally have it, and I would have been about $7,000 in so far in the 10 months of my puppy. So I couldn't encourage it more. And you know what? There's a lot of people out there looking for jobs that want to work with the cute puppies and kitties that we have. So go to accessveterinaryjobs.com. We're recruiting for all positions all the time. I guess the last thing I would say is it's Veterinary Technician Week. Happy Tech Week to all of the wonderful superheroes that we get to work with.
All right, Leah Basinais, thanks so much for your time tonight.
Thanks for having me.
Appreciate it.